Every part of the body is connected, and a blood cell going through the mouth will go through the toe within so many seconds. So it's very easy for us to transmit things throughout the whole system. Over the years, I feel medicine kind of took the mouth and took it out of the body, and everything else was more a medical problem. We didn't realize the impact that periodontal disease was having on the general health of the patient. And in the last 10 to 15 years, all of a sudden the mouth is coming back into, well, maybe we better check to see if there's any problem with the mouth or the teeth or infections and whatnot. And what's happening now is a complete, almost every 6 months, there's another area in medicine that's related to the possibility that periodontal disease is creating problems for them in other areas. Cardiovascularly, pregnancy can have an issue with babies being born, preterm. Point being, when you have any kind of infection, it creates an inflammatory reaction. And with the inflammatory reaction, you're going to have many of those chemicals going through the whole system. And the whole system reacts differently depending on what organ it is. Some connection, in fact, I think it's a riot. For years, dentists have talked about plaque as it relates to the bacteria that's in the mouth. And now all of a sudden there's a connection with plaque as it relates to cardiovascular disease. And that the two words that we've used for years, there could be a connection between those two. The formation of plaque on arteries and the formation of plaque in the mouth. As patients begin to realize that the infection in the mouth, which they usually don't know they have, it's something that has to be presented to them. I think there's even been a little bit, even today, a little bit of a whitewashing about, well, they're only just 4 to 5 millimeter pockets. I hear that a lot. A pocket is a relationship to the degree of the infection in the mouth. And we've kind of come to the understanding that, well, that's all right. Well, I don't think that's all right. I think it's important that we clean up the infection completely. Any other infection in the body, we don't go, oh, well, go ahead and we'll just leave it there. By going in and culturing and taking care of the patient in different ways, we can get the mouth to be in a lot better condition. So I think, one, knowing where we're going nowadays is better in controlling the disease. But certainly, if we can control the periodontal disease, we control the systemic aspects as it affects the whole system. I think what's important too is just because you have an inflammatory reaction in your mouth, it doesn't mean that it's directly correlated to other things, but it's one more risk factor that's on the pile of things, just like we know when it comes to cardiovascular health. We've got to watch our diet, we've got to watch our fats, we should be exercising. There's a whole bunch of things that are related, and it's hard to just grab one and say that's the whole thing. But as it relates to periodontal disease, it is one of those factors that, if nothing else, to save your teeth so you can eat properly. But it does have an effect in the rest of the body too. And to what degree, it's still being researched, but it's certainly an important aspect that shouldn't be ignored. Patients really, I think, get the benefit of what a healthy mouth is. And once they're there, they really don't want to give that up. They know that it's important to the rest of their health.